Welcome to another audio series by Dr. Eric Nepute. These audio series are meant to help you live a better, healthier life. And now, here's Dr. Eric Nepute.
Hey everybody, this is Dr. Eric Nepute, and if you're listening to this audio, that means that you have decided to commit to some lifetime wellness corrective care. And I am really excited to be a part of that journey with you. But you know, many times you've heard me say this, is that as a doctor, it's not only our job to treat you, but it's our job to teach you. And I just want to take a couple minutes to really explain to you why you're doing what you're doing. You know, in our world that we live in, our society, we're driven by pain and we're moved by pleasure. I mean, that's just the way that it is. And many of you that first came into our office or went to any chiropractor for that matter, or any wellness doctor, went there because you had a perceived problem. And that problem most likely was some type of pain, some type of dysfunction, maybe a disease. Something drove you, most likely out of pain, to go see some type of practitioner to help you, quote unquote, get better. And what I want to do is really, I want to shift your focus, because it's not really about pain, it's about your brain. And that's a saying that we have in our office that it really goes a long way, and I really want to make sure you understand what that fully means. So, you know, pain, much like any other symptom in your body, is nothing more than exactly what it is. It's a symptom. It's your check engine light in your car going off, telling you that there's a problem. The pain is not the problem. The stress on the nerve is the problem. Remember, the nerves that cause pain also control different areas of your body, different organs. For example, the nerves in the third, fourth, and fifth lumbar vertebra, the low back around the belt line, they can cause pain in your back, your hips, your leg, your groin, your knee, your ankle. All those areas basically from your belly button down can have pain in them because of those nerves. You know, the fuse is blown. But what most people don't realize is those same nerves go to the prostate in men, the colon, the large and small intestine. They go to the reproductive organs in men and women. They go to the uterus. They go to the bladder, the kidneys. So, you know, the reality of it is that those nerves, if they're damaged, yeah, they can be causing pain. But the biggest problem is what they're causing damage to with those organs. I've never, just so you know, I've seen probably, I don't know, to this time in my practice, which is only a few years in practice, and I've been in here in practice for about a decade, I've probably seen, let's say, 500 cases of men with prostate issues ranging from prostatitis to prostate cancer. And out of those 500 men that I've seen, there has been a 100% correlation with an injury to the nerve at L5 in the low back. And that nerve controls the prostate. So I'm not trying to tell you that to impress you, but to impress upon you the correlation. You need to understand that it's what these nerves are doing, and therefore what they're not doing when they're subluxated or when the fuses are blown, where the problems are. So, you know, let's kind of talk a little bit about why you get adjusted and why you should get adjusted, and honestly why you should get adjusted even if there's no pain, because that's really when the magic happens. Most of you listening are getting treated for a specific condition. That condition is known as subluxation or degeneration that's causing symptoms like sciatica or headaches or migraines or erectile dysfunction or bowel problems or whatever, or diabetes, whatever the symptom may be. Once we fix the underlying subluxation, which in most of your cases has been going on for years, depending upon what phase of degeneration you're in. And most of you that I find are in phase either 1 or phase 2 degeneration. Remember, phase 1 could take anywhere between 6 to 9 to 12 months to get correction, not to feel better, but to get correction, to where the x-rays show normality, where the nerve scans show back to normal, and everything function-wise is back to normal. Phase 2 degeneration obviously takes longer. That's a level of degeneration that has been going on for years to even decades. So therefore, it takes longer to correct, some cases up to 12 to 14 to 18 months. And we've seen in some people that have late stage phase 2, it can take up to 2 years to get correction. It takes that kind of time for the nerves to get better. You see, most people are willing to put in time while there's pain. But when the pain's gone, most people have the perception that they should be gone. You see, we live in a world that's filled the idea that for every ill there's a pill, and every potion and lotion there's something for every symptom out there, and we're marketed to that way. We're told that we have a problem, we need a pill, or we need a shot, or we need something to knock down the pain. But the reality of it is that the pain is not the problem. It's the cause of the pain. I just had a conversation, unfortunately, with a gentleman today who I felt so bad because I did such a disservice to this guy, not communicating to him what's really going on with his health. This is a gentleman, his name's Steve, and I saw Steve for about 8 weeks, and Steve had he actually had a helicopter accident when he was in the service. Blew out his back, ended up having back surgery when he was, I think, 21, 22 years old. This is back in, the 60s. And he was doing okay, and then long story short, he had a motorcycle accident about 5 years ago that almost crippled him. And, Steve sought us out from a referral, thought he'd give us a try. What we talked about made sense, talk about making some correction. We worked on Steve for about, I'd say 8 weeks, 9 weeks, and Steve and I had a conversation last week about his progress, and he's showing the disc spaces are opening in his spine, and his pain levels are reducing, and he's feeling better, which is great. But, Steve still has that medical model, that medical mentality of, I can just get a shot to make this go away. And Steve had a really bad weekend. He had a fall off of a ladder and ended up going to the urgent care. And at the urgent care, they gave him an epidural shot of cortisone in his spine. And that literally knocked out all the pain in his back. It was completely gone. And Steve came to me Monday of this week, and him and I had a conversation. He said, "Listen, Dr. Eric, I love you. I appreciate you. I think you're an amazing guy, and I love what you've got going on here. But I got this pain shot, and my pain's gone. I'm fixed. I'm cured. I'm healthy. I'm healed." And I felt so bad for Steve because I just didn't explain to him and communicate across to him enough so that he understands that he's not fixed. I could take an x-ray of him right now and would still show the same level of degeneration, decay, and pain. And the bottom line is that, we miss an opportunity to help change his life. And, the nerves at L4, L5 that are bad in him, that can lead to things like not just more pain, which the pain will come back when the medicine wears off. And I told him he could come back when the medicine wears off and we can get serious about it and get it fixed. But the problem is now his liver's not going to work well. His kidneys aren't. His small and large intestine are slowly going to degenerate. His pancreas is going to have problems. His prostate will have problems. He'll start losing testosterone in his body because that nerve is degenerating. And you see, that's what it's about. It's about the function. So I want to make sure that I impress upon you the importance of getting adjusted regularly. Research shows that once someone is out of pain, their body then has the ability to start healing itself. Once we get your body to what we call wellness, and wellness is when symptoms are down, when function has improved, and that's when we can really help completely explode your health potential, really get you to the optimum peak performance. Research shows that people who get adjusted regularly, and regularly means without pain on a weekly basis for years, for life. This is what the research shows. The research shows people who do this have better DNA, and their DNA determines their health. They have less expression for sickness, less expression for disease. They have less expression for cancer, heart disease, diabetes, stroke. They raise healthier babies. This is just a fact. The research supports this, and we have all the research available. It's on our website. If you go to neputewellnesscenter.com or like us on Facebook at Nepute Wellness, or call our office at 314-544-5600. We'd be happy to send that research to you. But again, I'm not trying to impress you. I'm just trying to tell you what's possible. People ask me often, and I teach at seminars often, and I ask doctors the same question. How often, Dr. Eric, do you get adjusted? Well, I have the luxury of having chiropractors work for me, so I get adjusted, if not 3 to 4 days a week, more. And the reality is I don't ever have any pains and aches and strains and symptoms. I get adjusted because my function is better when I get adjusted. I think more clearly. I have more energy. I can serve at a higher level. My brain is balanced when I get adjusted regularly. I go to these seminars and I teach and train doctors all over the planet on chiropractic. And I ask this question to my patient or my doctors. I say, doctors, if your patients had no time, money, or distance issues, how often would you recommend they get adjusted? And the doctors say, well, typically daily until their pain levels are down, and then once a week for the rest of their life. and they would get adjusted more if something came up. Listen, sometimes people get in the yard and they do too much stuff, or they get in their garden, or they go weekend warrior stuff, and they can hurt themselves playing softball. And, many of us, when we get older, we still act like children on the weekends, and therefore we need to get treated a little bit more. But the bottom line is chiropractic should be a lifestyle. It is a necessity, not a luxury. Ladies and gentlemen, the world has done a disservice to chiropractic, and chiropractors have done a disservice to the world by not getting this message out. The truth is that chiropractic is much like dentistry. You go to the dentist when you have a problem, you have a cavity. The dentist works on your mouth, they do some fillings, they do some work, they have a care plan for a set amount of time, and then once that care plan's completed, they give you some homework to do at home, don't they? They say, go floss, go brush, go wash your mouth out with these products, eat these good foods, don't eat these foods, and then come get checked up every couple months to make sure your progress is good. Well, the same thing is true with chiropractic. The thing is, though, is that our teeth can take more stress than our spine can. You see, your spine, we're not really spine and back doctors. We're spinal cord and brain doctors is what chiropractors really do. When we adjust you, your brain fires up like a huge cloud of exciting spasms in it. If you could see under a functional MRI, and the studies have been done on this stuff to show that when people get adjusted, their brain fires in different areas like you can't fire it with any other way. That turns the brain on. You ever heard that old phrase, if you don't use it, you lose it? Well, chiropractic has shown when people get adjusted regularly to keep the brain firing, especially the frontal lobe, and reduces things like dementia and Parkinson's and Alzheimer's and all these horrible things that there are of pandemic proportions. Just this last summer on the news, I remember there was so many studies and articles talking about and television programs talking about Parkinson's and dementia and Alzheimer's, about how it's not a matter of if, but when you're going to get this. I'm telling you, the people who don't get these are people who are under regular, consistent chiropractic care. People who get it, people who get adjusted, get their kids adjusted whenever they don't have symptoms. Stay on top of the symptoms. So, I want you to follow your care plan that's been prescribed for you by your doctor. Get in. Most people are here 3 days a week for the first 4 to 6 weeks. And after 4 to 6 weeks, we do a re-exam to do a checkup. And at the checkup time is really a time to reconnect and kind of chart your progress of where you were to where you're at and where you're going. Because it's all about moving forward. In life, you don't go backwards. You either spin in circles or you move forwards. And that's the truth, people. The reality of it is that you have the absolute power to attract in your life everything you desire. And so many people desire health and abundance. And chiropractic needs to be a part of that lifestyle. What chiropractic can do for you, your family, and your loved ones can absolutely change your life. I've seen kids that are ADD, ADHD, that it completely clears up and goes away with chiropractic. I've seen blood sugars balance out. I've seen people lose weight. I've seen family lives literally changed. Let me tell you a story, a very powerful story that really solidified to me why I have got to go out and be the messenger for hope, for health and wellness and chiropractic in my community. Many years ago, I had a patient. His name was Fred, and Fred was a truck driver. And, Fred, I'm just going to tell you, he came to me from a referral. He didn't like chiropractors. He's tried everything. The guy's had horrible migraines, headaches, pain all the time. And Fred just came in. He's one of those guys. He's a big burly dude, and he just never says anything. He comes in, he's like, my neck hurts, and I got headaches, and he's just mad all the time. Well, so I do my exam on Fred, and I sit down with them, and I say, here's the plan of action. We can help you fix your problem. You have face degeneration in your neck. You have subluxation and decay, and, it's going to take about 12 to 14 months to get correction, but we can do it. If you want to do it, we can do it. And he says, well, whatever, I'll try it. I'm tried everything. This is just, I don't know. Well, we'll see. We'll see, doc. And that was like the most conversation I ever had with him. And then he'd come in every day, and I'd go, Fred, tell me something good. And he'd just look at me, shake his head, and go, my neck hurts, back hurts, hands are numb, headaches, back, blah. Adjust him. And we do this. It was the same song and dance for like 6 weeks. And Fred, a lot of times, he has 2 small kids, and Fred would come in the office, and he would bring his kids with him. Sometimes then they'd just sit in the chair, and they'd watch their dad get adjusted. And I remember one day I come in and I come in the room and I get ready to adjust Fred, and he goes, hey, doc, I got a joke for you. And I'm like, you got a joke for me? I'm like, who the heck is this guy? This is like the most sentence that this guy's ever said to me in his whole life. And I love jokes. So I'm like, all right, tell me. So he tells me this joke. We both just die laughing hysterically. And I'm just like, this is a different guy. It's amazing. I'm like, who is this guy? And what did you do with my patient? And so I'm like, Fred, lay down. Let's check you out, man. And just like always, his son and daughter sitting there in the chairs. They're watching their dad get adjusted. They're on their little crayon books and all this stuff. And I'm feeling really excited. And I'm adjusting Fred, and I'm getting ready to tell him, you need to get your kids checked out, And I look at his son, and I say, hey. And Fred's on the table, and he's face down. I'm adjusting him, and I said, hey, what have you noticed since Dad's doing better? What have you guys noticed since Dad's been under care in our office? Waiting to hear that they're like, oh, he's smiling, he's happy, he's playing with us. And I said, what is the biggest thing that you've noticed? And this little kid looks at me, probably 9 years old, and I kid you not, like not even missing a beat. He goes, yeah, Dad doesn't beat Mom anymore. And my heart sunk. You see, this guy was so stressed out, so wired. He was taking so many painkillers, so many drugs, so much dope because he had all these pains and problems. The guy worked all day and he had to work. He was on dope and he comes home and he'd have to have a couple cocktails to unwind from work because he's so stressed out. And then the guy would come home and he'd get into a fight with his wife and beat his wife in front of his kids. And since we started adjusting him, he doesn't beat his wife anymore. Now, ladies and gentlemen, I don't get emotional about too many things, but when I heard that, it was like the Holy Spirit said to me, you hear that, boy? You need to get out there and you need to spread this with the world because the power that made the body heals the body. People are blessed and highly favored, and I want them to be connected with themselves and be connected with me, and chiropractic can help them do that. It can help them express abundance, life, peace, joy, and happiness like they've never, ever experienced. And that guy doesn't beat his wife anymore. And that broke that cycle. His kid's not going to grow up with the idea that men are bad and have a daddy complex and treat women horrible. That broke that cycle, that power of that adjustment, because we helped Frank balance his brain out. And so I get fired up about this stuff. Chiropractic is a necessity, not a luxury. You all need to get checked out. You all need to get treated. You need to get your friends, family, and kids treated, because people who are subluxated, people who have imbalance in their brain, it's not just about pain, it's about their brain. They cannot express full potential that God wants them to have, period. So if you're subluxated, ladies and gentlemen, you're not a good father. You're not a good husband. You're not a good provider. You're not a good baseball player, a good soccer player. You're not a good student. You're not a good baby. You're just not your full potential that God wants you to be because you are subluxated. And that's true, and that's biblical, people. I'm just going to tell you right now, I've preached that from a stage before. So I want you to follow your care plan, follow your doctor's instructions. You need to get adjusted regularly. You're going to get a re-exam about every 12 to 14 visits, every 6 to 8 weeks during the corrective care process. You follow the instructions. You do what's recommended of you, and you'll get the results. If you sow, you shall reap. If you do not, you will not succeed, period. Every 90 days in my office, we're going to take an x-ray of you during the corrective care plan. We'll compare apples to apples and show you the change. And we'll change up your care plan occasionally according to what you need. As your body gets better, we may only see you once a week, but you may be once a week for a couple months. And then after that, we may decide to do a wellness plan for once a week the rest of your life. We may do we might see you twice a month for the rest of your life. I would never go more than 10 days without getting adjusted. The research shows that if you are a subluxated for more than 10 days, you can start degeneration in your body. That's a fact. And most doctors don't recommend what people need properly because they're scared of being thought that they're just doing it for the money. They're just doing it for the... Ladies and gentlemen, we give hundreds of thousands of dollars of care away every month. It ain't about the money. It's about serving people. And I learned years and years ago that if you help enough people in life get what they want, you'll always have what you want. So I want to encourage you to get adjusted, get checked out, get adjusted regularly. Share this with your friends and family, and the doctors who recommend the care for you, treat them like family. Sometimes families get along. Sometimes families have, heated bouts of fellowship when they don't get along. Work it out. Talk it out. You got questions, talk to the doctors. They're here to serve you. I'm here to serve you. My team is here to serve you. So don't make excuses. Just get it done because you deserve life and you deserve it more abundantly. So do everything you can in your power to keep your visits. Get your friends and family checked out. Get your kids checked out. Get yourself fixed up because you deserve it, folks. I look forward to seeing you, your friends, and family on your next visit. Hope you enjoyed this talk. Have a great, blessed day.
We hope you've enjoyed today's message by Dr. Eric Nepute. For these audios and more, visit us online at neputewellnesscenter.com.